Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back. We appreciate you listening again to another episode of Dr. Ashley and the Boss, and we are continuing our very exciting series, Dr. Ashley, getting to know your Ashland County Mental Health and Recovery Board members.
Yes, I'm excited about this one.
Me too. We've got one of our longest serving members with us in studio, Nancy Udolph. Welcome, Nancy.
Thanks for having me.
Absolutely. And just to remind our listeners, we have been walking through what are mental health and recovery boards in Ohio. And we've talked about where they're located in an Ohio Revised Code, what it says in terms of the statute, their formation, their responsibilities. And one of the things we discovered was that mental health and recovery board members need to be residents of the county in which they're serving. So one of the first questions, Nancy, we always ask our members is, how long have you been living in Ashland County?
I have been living in Ashland County since 1976. So
76.
do the math, 47 years.
Yes. Yes, that's awesome.
Yeah.
And the reason we like to ask that question not only as a requirement, but we wanted our listeners to realize that the folks that are representing them on the board are very familiar with the county. And you have just demonstrated that again, that Nancy's 47 years in this community, serving in a variety of different ways, but just living here, raising children here, if I
That's
I
correct.
could say. Yep. I think she's very familiar, and as we'll get into a little bit, she has expertise in areas that the board needs and is desiring, and we're just very fortunate to have her on the board. So that leads me into the second part of my first question there, which is, how long have you been involved? And we were just discussing this a little bit, but how long do you think your involvement with the board has been at this point?
Well, I thought that I had only been involved for about 16 years, but I've come to find that I've been involved for close to 20 years.
Yes, you have. I was looking through the records. It's like a little time capsule. I've got a lot of photos from the past, and I love looking through those with some of our members. Nancy is not the only member. We've got other members that have also served a similar amount of time. And I just think that's amazing that folks serve 4-year terms. I've told the audience that typically it's a 4-year term. Most folks serve 2, and then some folks maybe sit off a year before coming back on. But Nancy has done that a few times now, and she's served in a variety of different capacities within the board. But again, saying all that, I think it's a good question, and I know our listeners will want to know. You could do a lot of things, Nancy. You do a lot of things, and you have done a lot of things. So what has been, over the years, your motivation to continue to serve and to give back on the Mental Health and Recovery Board?
I think for me, it sort of completes a circle in my life. So I started out working in the field of mental health, and I did that at the beginning of my career. So I did the work part of it.
Yes.
And then I started teaching social work at Ashland University, so I did the teaching part of it. But I hadn't done the serving part of it. And for me, that completed that circle for me. And I think serving in this capacity as a volunteer board member was really an important thing to do in terms of my career.
No, and that is so wonderful for the board, because then we get that teaching experience and that serving experience. We get those perspectives on the board. And I told audience members in other episodes, it's important and it's required that the board have members serving that have a background in counseling and social work, and that have practiced, and those are both areas that you've had experience with. Whether it's private practices or part of agencies, you've had that experience, as you say, not only teaching but actually practicing.
Right.
Okay.
That's right.
Well, these next series of questions come from Dr. Ashley, and we debated long and hard about these questions. Dr. Ashley's questions normally are the harder questions. Everybody says so.
It wasn't supposed to be that way, but they seem to be. But I'm impressed by the 20 years. That's awesome. And
it is.
Time flies when you're having fun, right?
It does.
Yes.
It does.
So, Nancy, if you could tell us more about your specific role on the board and what that looks like, that would be great.
Sure. I serve as a board member, but I have in the past served as chair of the board and as the chair of the planning committee. So I've served in several different capacities. But I think that the role of a board member is sometimes not understood all that well. And so I think it's important for the community to know that board members are responsible for putting together a community plan that helps guide our mental health program. I also think it's important to represent the citizens of this county. So as board members, we try our best to get out there into the community and kind of get a sense of what people are feeling and what the community needs. A big responsibility, I think, of the board is financial oversight, making sure that the dollars that we get from the federal government, from the state, from our levy are spent well. Just making sure that we have programming that meets the needs of the community. And then I think that the other thing that's important for board members is that the board has a specific philosophy that we think is really important to follow, and that is our three legs of the stool. And so I think that as a board member, we try to make sure that all of our programming is trauma-informed, that all of our programming, meets the needs of the community and does what we believe is a significant contribution to the community.
Yeah, that's great.
Yeah, absolutely. Board members do a lot for the community, and they're volunteers, so that's really amazing.
That's right. We emphasize that every episode, Dr. Ashley. These are folks that, they're busy. Everybody's busy, and we just appreciate them taking the time out, and we hope the audience recognizes that they're willing to take this time and to try to do their best, as Nancy said, to represent the community that they live in and they serve, and try to do whatever they can to ensure that the best behavioral health system is available for residents of the county.
Yeah, it's an important job. So another fun question here. Nancy, if you could tell us about the best gift you ever received and maybe why it was the best.
I really thought long and hard about this.
Okay.
Material gifts don't mean a lot to me, but I'm going to talk about two gifts that I think the first and the best gift that I ever got was to parents who loved me. I think to have a parent that really cares about you and helps you to achieve your goals is a gift that you can't match.
Absolutely.
In terms of material things, I've had a lot of wonderful gifts, but one of the neatest gifts that I ever got was my 7-year-old granddaughter was given $20 by her parents to spend at the Secret Santa shop at school
I love that.
for Christmas gifts. And she chose to spend quite a bit of that money on me. And she bought me this very cute necklace. It was a 4-leaf clover with a stone in the middle of it. And she said to me, "Grandma, it's a real diamond."
That's precious.
I laughed and I thought that was very cute.
Yes,
so
that's
so cute.
the fact that she thought of me was really special to me.
That's great.
Yes, I love that so much. Another one here. My last fun question for the interview. If money were no object and you could go back in time and do anything that you wanted with your life, what would that be?
Boy, this was another one that was really hard. My first reaction to that question was that I probably wouldn't change much, interestingly enough. I would be bored to death if I weren't doing what I'm doing. And to me, doing what I've done has been really, really important. But if I had a lot of money, I, number one, would make sure that everyone in my family was well taken care of. I would take the rest of the money and donate it for causes that I think would improve the community, not only the community, but maybe the world. Things like cancer research and, but we have a lot of agencies that could benefit from money, including the Mental Health and Recovery Board, right?
Let's not forget about us.
That's right. So I think that's probably what I would do.
I love that answer. You care a lot about others and community, and that shows for sure. Thank you.
Well, now we're back on easy turf. My questions. I've talked in other podcasts about the number of programs and services the board funds. And believe it or not, even though we are a smaller county and our budget is certainly not huge by any estimation, the board still routinely funds 50 programs and services between our 3 contract partners, and that's Appleseed, Catholic Charities, and Acada. So I asked the members, again, your perspective, and again, being around as long as you have, Nancy, I think this really matters. What work of the board do you think most positively impacts Ashland County? We do a lot of different things, like I said, with the 3 agencies, the 50-some programs, but what work, in your opinion, do you think most positively impacts the community?
Well, obviously, we fund the agencies.
Yep.
So I think that's extremely important, is that we do that work and make sure that the agencies can continue to function. In terms of programming, a few stand out to me. The school liaison program, I think, has benefited this community immensely. It's our children are our most prized possession, and if we can help them early on, I think that's the best thing we can do to contribute to the community, one of the best things. Our new respite housing, I think, will contribute in the future tremendously. The other thing that the board does that I think we don't recognize enough is how much we work to eliminate the stigma of mental illness.
That's a good one. Yeah.
And to me, that's a really important thing. And I've seen a lot of progress in that area, both on the state level and on the local level.
Yeah. And, since you kind of work in this space too, Ashley and Dr. Ackerman, I'm sorry, Ashley, I didn't mean to be
You can call
too
me
informal.
Ashley, David.
We've talked about one of the maybe unintended side effects or outgrowths of the pandemic has been a greater awareness of mental health and substance use issues, I think, more broadly in our country and around the world. And we think one of the positives has been, I think, an increased comfort level maybe in talking about mental health, substance use issues. It seems like I've noticed over the last 2 years, much more folks, much lowered stigma in that area. And we're trying to capitalize on that, because I think if we really think about it, if you think about a loved one or a friend or a family member that was struggling during the pandemic, and you can say, I think they were. I don't think they had the supports or the resources or the tools, the self-care tools to get by and through that in a way that they anticipated. So I don't know if you've noticed that in some of your work, but it just seems to us that it's been a better time to talk about some of these things, so we don't want to miss out.
For sure. I don't think that any of us would say that we don't know someone who has been touched by anxiety or depression or any of a number of mental health issues. So no, I think for sure that we're talking about it much more.
Yeah, maybe that was one of the positives that came from the pandemic. People just seeing, like within myself, like that was a difficult time. The people I love had a difficult time, and it's okay to talk about that.
Yeah, and it's okay to talk about that, Dr.
Yeah.
That's what I've seen a bit of a change, and that's a welcome change, because as you said, Nancy, stigma has always been attached to mental health and substance use for as long as back as I can recall. But I think it's getting better, and maybe that's just me being optimistic. But I think the work of the board, as you said, that's an important part, to normalize those conversations. So we whenever we're doing events and whenever we're talking and through our agencies and through you all as serving, we really want to normalize those conversations and let folks know it's okay if you're struggling with those things.
That's right.
Yep. Well, we have been speaking with Nancy Udolph, who's a long-term Mental Health and Recovery Board member, and we're getting close to the end of our questions, and we always want to make space for our guests to talk about anything else that they've been involved with, or any work of the board that we haven't already covered that maybe we should have asked you and we didn't ask you. So I'm going to leave some space for that, Nancy.
Nothing I can really think of. I guess I would just want people to know that I, in my years of being on the board, I have felt like it's been really a dedicated group of people. And one of the things that I think sometimes the community doesn't realize is how hard we work to get a representative sample of people on the board. Everything from consumers to mental health professionals to health professionals to citizens all over the county.
Yeah,
and I think that's really, really important. And also that it's a challenge. It's not an easy thing to meet the needs of folks who have mental health issues and substance use issues. And we work really hard to try to do that.
Yep. Agreed. And again, on behalf of Dr. Ackerman, I can safely say that we appreciate you, Nancy. Your perspective is a valuable one.
Oh, thank you.
I remember, if you recall, my first 2 years as the executive director, you were my board chair, and I benefited greatly by your patience and your kindness and your guidance and direction because I was still learning a lot, even though I always joke and say I was one of the most prepared executive directors ever because my mentor mentored me for many, many years. Still, there was a lot to learn, and the relationship, we'll have to do a special podcast on this, Dr. Ackerman.
Yeah, that'd be great.
The relationship between a board chair and the executive director of an agency is an important one, and we had a really, really positive one, and that helped, I think, the work of the board. It certainly helped me, so thank you for that.
Oh, you're welcome. I enjoyed every minute of it.
And thank you for being here on the podcast today and for all the good that you do, Nancy.
Sure.
Thank you, Nancy. Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.